Hello, my name's Lorraine Drapek, and I'm a nurse practitioner from Massachusetts General Hospital in Boston. I practice on the GI service in radiation oncology, and I'm also the lead clinician at the MGH Cancer Center Sexual Health Clinic. Thank you for joining me for this presentation this morning, and I also would like to thank the Anal Cancer Foundation for inviting me to this patient summit. I'd like to talk a little bit about some of the common side effects that can happen during and immediately after treatment for anal cancer. So with chemotherapy, mouth sores are very common, particularly during the first week of treatment. Low blood counts, often the white count and the platelets, fatigue, some loose stools, and hair thinning or loss, the hair thinning of your head, sometimes a little thinning of the eyebrows as well. From radiation therapy, these are effects that happen over time. Fatigue, loose stools, urinary frequency, which means going to pass your urine more often during the day as well as in the evening, some burning with urination, radiation dermatitis, which are the skin effects from radiation, and hair loss within the treatment field. Let's talk about some common long-term effects from chemoradiation. There can be change in bowel movement patterns, and by that I mean depending on food. It can range from diarrhea to constipation. Pelvic insufficiency fractures are usually found in the sacrum, and that would be pain would develop in those areas, and MRI would diagnose these. Pelvic floor dysfunction can also occur, and pelvic floor physical therapists are very helpful in this area. Changes in sexual function for men and women. So for men, it's sterility, erectile dysfunction, possible anejaculation, which means no ejaculate. For women, it's sterility, vaginal stenosis, vaginismus, vaginal dryness. And for both, there can be changes in orgasm and anal stenosis. Some tips to thrive during treatment and shortly after treatment completion. So for these short-term effects, mouth care. Develop a mouth care regimen to minimize mouth sores. The tried and true that we've used over 40 years is a teaspoon of baking soda or salt in 8 ounces of warm water. Rinse your mouth out 4 times a day, so after meals and at bedtime. It helps keep the pH balance of inside your mouth. This is very important because it's important to eat, and brings me to my next point. High protein balanced diet. Proteins are the building blocks for normal cells to replace themselves. Skincare in the radiation treatment field. Wear loose, comfortable clothing. Gently wash the treatment area with a mild moisturizing soap and pat it dry. We ask to decrease friction as much as possible. Skincare products as recommended by your treatment center, so go by their skincare regimen. Some evidence-based interventions are mometasone 0.1% or betamethasone 0.1% twice per day. These are steroid creams and are by prescription only. Apply an emollient cream after a shower. Oncology Nursing Society has on their site Aquaphor, Eucerin, or Calendula. There's not a lot of evidence for any of them, but they can help seal moisture in the skin. And then sitz baths or tub soaks are also important. Let's talk a little bit about long-term effects of chemoradiation. Erectile dysfunction. PDE5 inhibitors, and this is Viagra or Cialis as examples, they're helpful and most beneficial if there is some erectile function. Therapeutic vacuum pumps can be found online. There are several brands. There is a photo one at the bottom of this slide. Caverject and penile implants involve specialty certification, usually from a urologist who has a subspecialty in sexual health. Vaginal and anal stenosis. Dilators are beneficial. Pelvic floor physical therapy can also be beneficial. Vaginal dryness. Lubricants and moisturizers are often very beneficial for this, as well as for dyspareunia, which is pain with sexual contact. Of note, lubricants should be used with both vaginal and anal penetration to make sex comfortable for both parties. Just some resources and specialists. I always have this as part of a wish list. Social workers, who can be very important for both transportation, financial assistance, emotional health. Some do sex therapy as well. Support groups, online resources, such as what you can get through the Anal Cancer Foundation. Gynecology and urology specialists, which can be a key support for survivorship care. Sex therapy, there are sexual health psychologists that can help with both individual and couples therapy, and pelvic floor physical therapy for both bowel and sexual health issues. Some common terminology that you might hear during treatment: radiation dermatitis, which is the skin reaction caused by radiation therapy. Radiation proctitis is inflammation of the rectum caused by radiation. Urgency can be bowel or bladder when you have to hurry up and get to the bathroom. Tenesmus is a spasmodic feeling in the anal canal where you feel like you need to have a bowel movement, but nothing happens when you actually try to have one. Incontinence can be urinary or bowel accidents. Neutropenia is a low neutrophil blood count, causing you to be more susceptible to infection. Oral mucositis are mouth sores. And IMRT is intensity modulated radiation therapy, a technique that's commonly used in anal cancer today, where beams are contoured and shaped. And the advantage is that it decreases the intensity of the effects, the toxicity effects of radiation. Thank you very much. It's been a pleasure to put together this presentation, and I look forward to speaking with you in the question and answer session.